Hello and welcome to More to the Story with Molly White. I am so glad you joined me again today. We have a very informative show, and I just hope that you would stay tuned and invite your friends to listen in. It's really important for women's health to stay tuned today. So, my co host, Mary Browning, is not with me today. She is actually in Washington, D.C., with a group of women who have been sharing their testimonies for some media outreach to educate people in states where they're trying to put abortion in their constitution or abortion rights. And so these women are not only sharing their stories to be aired in these different, what we call battleground states, they are also meeting with legislators today, sharing their stories as well. So we thank God that Mary is there, and we're praying for her and these ladies. I also want to kind of give a little warning or something that we're going to be talking about some sensitive subjects. We are talking about breast cancer today, and the link between breast cancer and abortion, and breast cancer prevention and breast cancer risks. So if you don't want your small children, young children, to hear this show, you can always listen to it later, or put them in another room to play or do whatever they want to do. But I just wanted to let you know. And I do kind of want to say, and I'm sure Dr. Lanfranchi will say it as well, that just because you've had an abortion doesn't mean you're going to have breast cancer, or just because you had breast cancer doesn't mean it was linked to an abortion. But there are risks involved. And so I do want to introduce my very, very awesome guest today, Dr. Lanfranchi. And we'll bring her on as I am reading her bio. Welcome to the show, Dr. Angela Lanfranchi. I appreciate you coming on today. Now, you are a breast cancer surgeon, and 1975 graduate of Georgetown School of Medicine. You are a clinical assistant professor of surgery at Rutgers Robert Wood Johnson Medical School, a fellow of the American College of Surgeons, and certified by the American Board of Surgery. Dr. Lanfranchi was surgical co-director of the Steeplechase Cancer Center in Somerville, New Jersey for 10 years. She's the co-founder and president of the Breast Cancer Prevention Institute, which is our producer will put that website on the screen here soon. It's a 501c3 nonprofit charitable corporation that has at its mission to educate lay and professional communities in the methods of risk reduction and prevention of breast cancer through research, publications, and lectures. She was named a Castle Conley Medical Limited I'm sorry, my voice is going. New Jersey top doc for women's health and breast surgery for the last 10 years she practiced. She is the published author of articles on the physiology and epidemiology, you're going to have to help me with that, of abortion, breast cancer, and hormonal contraceptive risks and informed consent. In her work with Breast Cancer Prevention Institute over the past 25 years, she has traveled nationally and internationally to Australia, New Zealand, Canada, Europe, China, Korea, India, and South Africa, speaking at medical schools, hospitals, universities, cancer organizations, local and national governmental bodies, and the United Nations about the breast cancer risks, including its association with induced abortion and hormonal contraceptives. Welcome to the show, Dr.
It's
Lanfranchi. And
it's great to be here.
well, it's good to see you. It's been a long
Yeah.
time since we've seen
Yes,
each
your
other.
viewers should know that we used to see each other every time we went to the UN, for an over 10-year period, giving out this kind of information. So
Yes. Yeah. My previous guest, Denise Mountainay from Canada, was actually, I don't know how she met you or learned about you and Dr. Joel Brin, but I
I
met,
think it was through Babette Francis,
oh,
the
yes.
Australian, because Babette was married to a pretty important guy down in Australia, Charles Francis, who is a member of Parliament down there and an aide de camp of the Queen in the Air Force Reserve. I mean, and both of them used to do things like put up billboards saying, did you have an abortion? Do you have breast cancer? Call this number. And Charles actually won two cases in Australia where women got damages because they weren't told about the psychological risks of abortion and the risk of breast cancer. So those were the two first cases. And since then, there have been three cases in the United States where there were settlements in favor of the plaintiff.
Awesome.
So
Awesome. So,
Babette brought us together. God
okay.
rest her soul.
Oh, yes, amen. She just recently passed away. She's a remarkable woman. She had an NGO, a non governmental organization that
Right?
had credentials to attend the United Nations uh, Commission on the Status of Women conferences and other conferences. And so
Yep.
that's when I met you and Dr. Joel Brand. And that's when I was blown away by the information that you shared during side events and parallel events during these conferences, educating women from all around the world about breast cancer risk, breast cancer prevention, and the abortion breast cancer link. So let's talk about that today, Dr. Angela. Um, First of all, I guess, since we're, a show that's dedicated to educating audiences about the risk of abortion, both psychological and physical, let's just start there. When did you discover, this link between abortion and breast cancer?
Well, I first became aware of it um, when I was limiting my practice to breast surgery. And when I had graduated medical school in 1975, the risk of getting breast cancer was about 1 in 12 women. That was the
Wow.
lifetime cumulative risk.
Wow.
And then by the time I was specializing in the 90s, it had gone up to 1 in 8.
Wow.
And then when I was in medical school, grandma got breast cancer.
Right.
Postmenopausal women got breast cancer.
Mhm.
And there was 1 month where I saw 3 women in their 30s with breast cancer, and they had little kids, like 2 and 3 years old.
Mhm.
And mentally, it was just very depressing for me because all 3 of them kind of had a bad prognosis. And so I started looking for reasons why. And I was getting dressed, ready to go to the hospital one morning, and there was a CNN um, news piece that's that I heard very briefly about Joel Brind, who was having a press conference with the other authors of a meta-analysis that he had done in 1996, or published in 1996, that showed that there was a link between abortion and breast cancer. And so I started taking that complete reproductive history because abortion is a medical term and miscarriage is a lay term. So so when you ask the history, gravida para AB, it gravida, how many times were you pregnant? P, how many births did you have? And A, how many miscarriages, including and induced abortions, did you have? It was all kind of lumped together. So at that point, I started differentiating them and asking my patients, how many times were you pregnant? How did the pregnancy end? Was it a live birth, stillbirth, miscarriage, abortion? Was it multiple births? And in the sequence, like what was the first pregnancy you had like, and how many weeks were you when you gave birth and had the miscarriage or whatever. And I saw the pattern where these 30-year-olds that were getting breast cancer wouldn't have that familial history. Oh, they inherited the bad gene. That's why they're getting it at 30. No, it was they pretty uniformly would have a history of um, oral contraceptives, which isn't hard to have that history because, after all, 85% of women in the United States have taken them at one point or the other. And not just oral contraceptives, the other hormonal contraceptives, like the Mirena IUD and things like that. Um, so, and then because, like, let's just consider the people that took, quote, the pill. Well, if you go to the CDC website, the pill has a failure rate. Now, most people have it in their mind that the pill is 100% effective. And
Yeah.
if a woman gets pregnant while she's on a pill, and they're, maybe her boyfriend thinks, oh, you just stopped taking the pill to get pregnant, so I'd have to marry you, and things like that. No, they're taking the pill exactly as directed on the package, and they're getting pregnant. Well, how often does that happen with typical use? Well, it's 9 out of 100 women, 9%. So if you have 9 million women taking the pill and 9% are going to get pregnant, even when they take them like they're supposed to, that's hundreds of thousands of women having unplanned pregnancies.
Hmm. Yep.
And then if you go to Guttmacher Institute, which is the research arm of Planned Parenthood that does the most abortions in this country, they say, every year will have a different statistic, but it'll be from anywhere from, 40 to 50%, usually in the 45, 49% range. So now you've had on 800,000, say roughly 800,000 unplanned pregnancies, half of them end in abortion. I mean, we're talking a
Hmm.
lot of women every year because and even Guttmacher says, like most women have taken some form of contraception in the year that they had their uh, unplanned pregnancy. So um, it's very, very common. And so in my own practice, that's what I was seeing. So um, that's how I found out about it, from that news uh, blurb. And when I first heard about it from a pro-life family practitioner, I used to think, that's crazy time, like, how could that be? And it's not in my textbooks. But what I didn't realize, if you read the fine print or you read the entire textbook, you actually did see that. There,
Wow.
there was one of my textbooks from 1991, when I did read it cover to cover, in the chapter on, which was essentially on molecular biology about breast cancer, it said, however, first trimester abortions do increase breast cancer risk. I nearly fell off my chair when I read that. And one of the people who wrote that chapter was a PhD that worked at Georgetown. And I actually went to Georgetown to talk to him. I said, how
Wow.
did you ever get that in that textbook? And he said to me, look, everybody knows that.
Wow.
All the
Everybody except
scientists
the
know. All the scientists know that.
wow.
And if
Everybody
you
except the women. Yeah. Everybody except the women who are having abortions. Yeah.
listen, if you, this is so funny. They had, well, it's not funny. In 2003, the National Cancer Institute had a workshop where they were specifically looking at breast cancer risks. and so they concluded reproductive breast cancer risk. And they concluded at the end of it that abortion was so not a risk for breast cancer, we shouldn't study it anymore. However, they admitted that premature births before 32 weeks doubled breast cancer risk, and they didn't really know why, so they'd have to study that more. Now, if you think about it, what's the physiology behind the abortion breast cancer
Right.
link? So, what happens is as soon as you get pregnant, one of the first early signs of pregnancy is sore and tender breasts. And why is that? Because immediately after conception, even before implantation, the embryo is putting out HCG, human chorionic gonadotropin, and that's what you measure in a pregnancy test. And what that does is it stimulates the mother's ovaries to keep producing estrogen and progesterone to support that pregnancy. And so that stimulates the breast to grow. And there are different maturation levels of the breast. So your breasts aren't fully matured until they're able to produce milk. Because, why would you have to have, your breast tissue fully matured? So you don't have a lot of it, initially. And then the estrogen and progesterone make you turn your breast tissue into milk producing, fully differentiated, cancer resistant type of breast tissue. And when does that really happen enough to give you some protection? It's 32 weeks.
Wow.
And that's when the HCG has come down, but the human placental lactogen that the fetus also makes goes up and levels off around 32 weeks. So
Mm,
it's the same physiology.
wow.
So the hormonal environment that your breast tissue is going through is that you double the amount of breast tissue you have. Everybody knows you get bigger breasts when you're pregnant.
Right.
They actually double in volume. And then after 32 weeks, they all become mature enough to produce milk.
Mm, wow.
So that's in preparation of breastfeeding, and it only makes sense.
Wow.
So that first pregnancy is very critical. So if you have an induced abortion before that first pregnancy, as we tend to do in Western Europe and in America, because you want to limit, you don't want to have that early pregnancy. That's really the best thing there is for your breasts. And it's the thing that reduces your breast cancer risk the most. And um, I think I have it on our website, or it's somewhere on our website. One of the people that was running the reproductive national breast cancer uh, workshop in 2003 was Leslie Bernstein. And so after the conference, this news organization went to her and said, "So, what do you think your conference showed?" And she said, "Well, the biggest bang for the buck in terms of lowering breast cancer risk is having an early first full term pregnancy." And it's actually not just full term, it's anything past 32 weeks. But you won't hear me telling young women that, because you know, we shouldn't link abortion and breast cancer.
Wow.
And you used to, I don't know if you still can, but you could go online, look for her, and find an MP3 player and hear her saying it in her own words.
Wow.
And in my own textbook, this is so crazy. My own textbook, they'll give a table for a clinician to look at, um, primary prevention of breast cancer. And they'll talk about public policy should be bicycle paths because exercises lowers breast cancer risk and things like that. And then if you read the text, it says the greatest impact of lowering breast cancer risk is having a early first full term pregnancy.
Wow.
But we didn't list it in the table because it would have detrimental ecological and sociologic effects. Ecological. What are they talking about? Too many people and you're worried about fish? I
Yeah.
mean, it,
Yeah.
it, it was astounding to me that they actually put it in. And I actually confronted some people who wrote textbooks. I walked up to the guy who, I was at a meeting. I can't remember exactly which year, but I said, he was the head of radiation oncology at one of the Harvard hospitals, and he was the one of the editors of this standard textbook. And I said, I just laid out, you know, uh, a couple $100 for your textbook, and it's inaccurate when it comes to abortion. And he goes, "Oh, well," and I said, "But that's inaccurate." And he goes, "Listen, it's going to take a woman to bring out this information." And I said, "Well, I'm a woman. Help me get the uh, database in New York State," because New York State, Holly Howe had put out a paper that showed that in women under 40, their biggest risk for their breast cancer was linked to abortion.
Wow.
I said, "Let me do a 10-year follow-up study. They won't allow us to look at that data." And
Wow.
he said, "You don't understand. You need to speak to this other woman who was a lawyer in charge of a big advocacy group,
Mm.
I think the National Breast Cancer Coalition. And she was giving a talk at the meeting. I was like stunned. I had so many big professors admit to me that they knew it was true, but they didn't want to talk about it.
But had any of these professors ever performed surgery and dealt with young women who were suffering from breast cancer? I mean, are they so out of touch with patients and women that they're cold hearted about this and not
Well,
wanting, you know?
in a word, yes. It I I approached a surgeon who wouldn't even let us have a table at his big conference in Miami
About breast cancer prevention.
about, yeah,
Yeah.
about, and including stuff about the abortion breast cancer link. In fact, I told Dr. Brind, I said, Breast Cancer Prevention Institute should have a table at one of these big conferences I go to, a couple times a year. 900 surgeons, pathologists, radiation oncologists, medical oncologists, they're all there. And we should have a table, an exhibit table, and give out our information. And he said, "Yeah, that's a good idea." So we paid for one. And he said, and it was about $2,000. And he said, "We're a nonprofit. We should get it cheaper." I said, "Joel, don't talk to them. Be happy we got a table and we'll go down." But he couldn't help himself. He called up the head of the conference and said, "We're a nonprofit. We should get it cheaper." And he said, the guy who ran the conference said, "Well, exactly what do you do?"
Oh
And Joel
boy.
told him.
Oh, Joe.
And then we get a letter saying, "We made a mistake. There are really no more exhibit tables. Here's your money back."
Oh.
So I go down there and I went up to the guy and I said, the surgeon, I said, I just had a notice on my chair saying additional tables were given out to these exhibitors, and they happened so recently we couldn't get them into the program. So here's a little flyer about them, so you know about them. So I went up to him and I said, "You took away our table. Why?" And he said, "Well, it's just too political." I
Mm,
said, "Well, after the Bush Gore election, is it going to still be too political?" It was one of the Bush's elections. I can't really remember. It was around 2000, whenever that was.
mm,
And
yeah.
he said, he is it still going to be too political then? And then I said, "Well, do you know about Semmelweis?" And since he was Jewish, he knew. Semmelweis was an Hungarian Jew that went to an Austrian hospital to get educated. And he discovered, he thought it was odor particles on the hands of doctors coming from the autopsy room without gloves to the maternity wards, and then they would examine patients, and they'd have all this stuff on their hands because in those days you didn't have gloves.
Mhm.
So he noticed that on the maternity wards taken care of by doctors, the maternal mortality rate from puerperal fever, fevers that you get after giving birth, were highest 30% in the doctors' wards, but in the midwives' wards, it was only about 10%, not 10%, like 2%, 3%.
Mm,
And he noticed that the midwives were always washing their hands. So he thought it was the odor particles because it was before the germ theory had come out.
mm,
And so he said he kept pushing them to do an experiment. And they kept putting it off, saying, "Oh, it's the medical students being rough, or it's the priests, because the priests are walking through the women's maternity wards." And that's, our ward is next to the priest's office. And finally, he got them to dip their hands in sodium hypochlorite, which is basically Clorox, to get rid of the odor particles before they examined patients. And the maternal mortality rate went down to what it was in the midwives' wards.
wow.
So
Wow.
he proved hand washing saved the lives of women.
Mm, wow.
So
Pregnant women.
instead of
Mhm.
giving him an award, they drummed him out of town.
Wow.
And 5 years later, he's in an insane asylum and he's dead.
Wow.
So
Wow.
that was Semmelweis. So Jewish people know about Semmelweis because he was Jewish. And I said, "Dr. Osmond, you know about Semmelweis?" And he goes, "Yes." And I said, "So you realize women are dying?"
Mm,
And so to answer your question, yes, they know that women are dying.
wow. And this really, like you said, is politically motivated.
Yep.
And sometimes I think, why don't they want women to know about this risk?
Well, it's not just politics. It's huger than
Well,
politics.
I'm saying even in the medical community, I just feel like they don't want to get their pantsuit off, you know?
But you also have to understand that doctors are part of the culture.
Mm,
And
yeah.
the doctor, you might have, especially, now, I mean, they're believing, I mean, they're worried about the earth. So the earth has become Gaia,
Mm,
the goddess of the earth.
mhm.
And people are bad for it
Yeah. Which
because we
is still
pollute. We
degrade.
have a big carbon print.
Yeah.
And the fewer people you have, the better. And so things that eliminate people are good because
Yeah.
you're saving the
Crazy.
planet.
And that's so not true. You can't save a planet without people. You got to have people to save the planet, but that's another subject. But
Yeah,
I do have a couple of questions.
go
I
ahead.
just want to clarify that what has been shown medically and through research, the younger a woman who has a full term pregnancy
Or something over 32 weeks.
or something over 32 weeks. What's a normal pregnancy is what, 40
Well, it's 40 weeks,
40
and
weeks.
but but you will get the benefit of breast cancer reduction if you can maintain that pregnancy to at least 32 weeks.
Okay. And so then, from what I remember learning from you, is that if you nurse your baby after that.
Absolutely. And it's proportional to the amount of time that you nurse.
Okay.
So if you nurse in a way that the baby's getting all of their calories from you, you'll probably not be fertile for about 2 years.
Hmm.
Women get lose their periods. And so every month you're not having these estrogen progesterone cycles that are stimulating your breast. So the more estrogen you're exposed to in your lifetime, the higher your risk. So if you have menarche, your first period, when you're 9,
That's so young.
or if you continue having periods until you're 55, 58, compared to the average age of 53 at menopause, the more menstrual cycles you have, the higher your risk.
Mm.
So the other thing is that by breastfeeding, you continually have your breast tissue in a state of what's called terminal differentiation, capable of producing milk, right?
Hmm.
And that protects you.
Mm.
So the longer you breastfeed, the lower your risk.
Hmm. Yeah.
And the more for every kid you have, if after the first, you lower your risk another 10%.
Okay.
So what I would like any listeners to know is also that this say you had an abortion, at 18. A lot of women get pregnant within that next year again.
Hmm.
There's psychological reasons for that, but they get pregnant again. If they keep that pregnancy and deliver a baby after 32 weeks with that second pregnancy that happens right away, their risk is going to go down.
Okay.
Like Janet Daling had the study that showed, uh, that there was about a 50% increased risk of breast cancer with abortion, showed that if you had a pregnancy within 10 years of that pregnancy that you aborted, your risk was 10% instead of 50%.
Okay.
You know,
And
it,
so, what about women who have multiple abortions in a row? Like,
well, a
because
lot of a lot of times they can't help it. Well, because for this reason, if you think about what happens in labor, it takes hours and hours and hours and hours and hours to get your cervix soft enough, dilated enough, thin enough to have a baby come through it. Now, abortionists don't have that time.
no.
So they forcibly dilate your cervix. And your cervix is like the size of like a thumb. And it has muscle in it and a lot of connective tissue, and it has to be very, very, very strong because that tiny little muscle is holding in 9 pounds of baby and fluid, you know whatever. Well, if you've had multiple abortions and you've had your cervix forcibly dilated, it weakens it. So the more abortions you have, the higher your risk of having a preterm birth. Now, it's important history to know and give your obstetrician, because there are things that they can do to keep that baby in, like maybe put you at bed rest or do something called cerclage, where they kind of sew it shut so that you won't have a premature birth. Because even if when they say the point of viability is like 26 weeks or whatever, that only means that half the babies live at that age.
Mm-hmm.
So there are it's a good, so it increases the risk of premature births. Premature births before 32 weeks doubles breast cancer risk.
Because you're still stopping the production of your milk glands.
Yeah,
You know, and it,
you're stopping the production of the maturation.
okay, the
The
maturation.
the and I'll tell you something else that's really interesting. It's the fetus that makes the HCG, that's the pregnancy test. That hormone also stimulates the mother's ovaries to produce inhibin. Inhibin is a tumor suppressor protein.
Wow.
So if the mother starts making cancer cells when she's rapidly developing, her breast tissue, the inhibin is already there trying to fix those mistakes.
Hmm.
And it's such a powerful thing that they make, the baby makes for the mother, that they've actually used it to treat breast cancer.
Wow.
So human chorionic gonadotropin that the fetus makes actually can be used to treat cancers.
Wow.
Okay.
That's so astounding.
So we're fearfully and wonderfully made.
Yeah. Yeah.
Yeah.
That's so astounding how
Isn't
God
that
works.
amazing?
And that just counters the argument that the abortion industry puts out there is abortion is women's health care. Abortion
Oh,
is health care.
it's one of the worst
Totally,
things you can do.
yeah, totally a lie. And and
Yeah.
and
Yeah.
they know it's a lie.
They you can you have an unplanned pregnancy, and I fully understand that women are between a rock and a hard place. But with all the people that are on the waiting list to adopt babies, you know, the woman who goes through that pregnancy gets the all the benefits, health
All the health
benefits from
benefits.
having that pregnancy,
Mhm.
and a couple is happy,
Mhm.
especially if they have open adoptions now,
Yep.
where when the kid is 18 you can contact them, or because children want to know who their parents are.
Yep. Yep.
Children want to know who their sperm donors are.
Yeah. That's true. They it's
It's
it's built
something
in.
very innate.
Yeah, it's built into us. We need to know
It's
who our
built in.
biological parents are. That
And
gives us our identity.
what's really interesting, and that supports, a lot of times they'll say, oh, psychologically some people are happy. Well, what they did was these rats experiments where they have baseline behavior for rats, like how they interact with each other, how much they eat, how active they are. Well, they take that group of rats and they give them mifepristone at a
Mm,
time, which is the abortion pill, at a time that corresponds to a first trimester abortion. And after they're aborted by that chemical, the rat's behavior changes.
wow.
And they sit in a corner, they don't groom themselves, they don't eat as much, they don't interact socially.
Wow.
So,
Just
and
like humans.
the rats aren't sorry they had an abortion. I mean, they didn't do it. It's something that's physiologic about it.
Mhm. Yeah.
There's no pressure. There's something in our physiology where we're hardwired for that. So
Yes. Well, that is so interesting. And let me see. I had a couple other questions. I was taking notes when you were talking. Oh, another thing, is that when you were talking about, you know, reporting, our abortion history to our doctors and to our breastfeeding
yes, you
doctors,
should tell them.
most women do not.
No,
Most women do
it
not.
brings back awful memories.
And it's the shame factor, it's the guilt factor. I didn't, and I was I didn't ever really tell him how many pregnancies I had because of that. But I know up until recently, probably about 5, 6, 8 years ago, for my last breast exam, I do have them. I just do the ultrasound, not the mammograms. But I looked at the questionnaire, and they did not talk about abortion or how many pregnancies you had, how what the outcome was. They
I
did,
know they.
and I
Have.
asked her. I asked the doctor. I said, "Why don't you ask about the abortion?" I said, "Because there is a direct link between abortion and breast cancer." And she
It's
goes,
not.
"Oh, yeah." She
It's not in their. It's very hard to find in the textbooks. But
Yeah.
one thing you should say to them is when they say there isn't a link, you say, well, why is it that preterm births before 32 weeks doubles breast cancer risk? What is the difference between the delivery of a live infant versus a dead and dismembered one?
Wow.
If
Yeah.
it you know, the changes in the mother's breasts in both circumstances are the same.
Mm.
You
Wow.
know, they had that stimulatory growth of the cancer vulnerable breast tissue, so there are more places for cancers to start, and then they lose the protective effect that they get after 32 weeks.
Mm. Wow. Yeah, that's a good question. And we want all of you who are listening to have that information. And if you're a woman and you're going to your
Oh,
OB-GYN doctor, or, you find a lump, make sure
they
you
can
tell
get
them.
all the stuff on our website, which
Awesome.
is breast cancer,
Prevention.
www.bcpinstitute.org. We have brochures like this. All of the brochures have references on the back.
Amen.
And it inside it'll explain that, in fact, in this one, that you can download for free in a PDF file from our website. You go to the resource tab, and then under the resource tab, they have brochures, and you can download this in a PDF file and
It says
just print it
abortion and
out.
breast
You don't
cancer.
have to buy anything.
Mm-hmm.
And
Yeah.
in the middle of it is a whole table of what increases and decreases breast cancer risk.
And that,
And it explains the physiology in a way that anybody can understand it's not rocket science. It's not difficult.
it's very important. And I should have had some of those resources when I attended the convention last week, because it would have been important to hand that out. But it's important for you, our listeners and our viewers, to get this information, to educate yourself, educate your daughters, educate your neighbors on this, because we're all about prevention, you know, and risk reduction.
Yeah.
So let me see if there's something else. We talked about that. The premature birth. Now, I do have a question, because I have a friend um, who had an abortion, and her breast milk came in within a day or two afterwards. How
How
far?
many weeks was she?
She did not know. They
She
did not.
might have had a birth beforehand, and
No,
or
no.
I don't I I don't.
You don't know what?
You'd have to have a lot of more information than that to really understand why that would happen.
Yeah, because
You,
that's just something she's trying to figure out.
sometimes if your prolactin levels are elevated, you can have breast secretion.
Hmm.
So um, I,
I don't even know how
I
common that is after abortion. I really don't.
yeah
You
the
know.
yeah and y- any you have to remember that about 90% of all conceptions will end in a spontaneous abortion or miscarriage in the
Mm,
first trimester. A
wow.
third.
Mm,
Okay. So sometimes women will have an abortion at, 8 weeks, 9 weeks, or something like
mhm.
that, like as soon as they find out. Well, maybe they're aborting surgically or with mifepristone a pregnancy that was already going to miscarry at 11 weeks. They don't know.
Mm.
And so that abortion wouldn't increase their risk.
Okay. All right.
You
Because the
see?
baby may have already quit developing. That's
Right.
interesting. That's
Yeah.
interesting to know.
So um, an individual will never really know why they got breast cancer. They could have every risk known to man, and it could have been a spontaneous mutation,
Mhm.
critical mutation
Mhm.
that caused them to form the breast cancer.
Mhm. So let's talk because we're and I appreciate you taking time to be with us. So
What time
let's
is it now?
we've been on about 45 minutes, but and that's good because it's informative. But
Okay.
let's talk about some prevention, some risk prevention.
Yeah. So um, exercise definitely decreases risk. I can't give you the mechanism for that. Not taking hormonal contraception is because that increases your risk. There are ways to contracept that don't increase your risk. You can use a double barrier method, condoms and diaphragms together with spermicidal jelly. You use those three things together, you're never going to get pregnant. I mean, not never, but anything can happen, but it's it's going to be very low.
And it's just as
Uh,
effective or more so than the oral contraception.
yeah. Okay. This is an interesting thing. Why does alcohol increase your risk?
Yeah.
Well, it's not because the alcohol in and of itself is toxic to your breasts. It's because it's toxic to your liver. And your liver is what metabolizes your estrogen, gets rid of your estrogen. So the more you drink, the more estrogen you have
Wow.
on board. And the more, remember, I said, the more estrogen you have, the higher your risk. And so that's why men develop man boobs when they're drinkers.
Wow.
And a lot of times they'll become impotent
Wow.
because their estrogen levels are high.
Wow.
Um,
Interesting.
it is. Let's see.
And you I remember you had talked about oral contraceptives, birth control,
Yeah.
and maybe being on them for a short period of time is not quite as bad as starting like when you're 14 or 15, your
Yeah.
mother
What
puts you on them
happened?
and you go all
Yeah.
the way through your
Yeah.
childbearing years.
The longer you're on the contraception, the higher your risk.
Mhm.
Um, so uh, if you need to take them because you're having a hormonal problem, that's one thing. What typically happens is girls will have dysmenorrhea. They'll have painful periods. And so they'll take them to the doctor. Oh, I can fix this. I'll give them the
Birth
birth
control.
control pills. Or the kid has a lot of acne. Oh, I can fix that. Birth control pills. Parent is happy because if the kid makes a mistake and happens to have sex, then maybe she won't get pregnant. But what it does is it's especially damaging to teenagers. And once they start on the pill, they tend to keep taking it until they're in their 30s and they want to start a family.
Mm.
In the meantime, they've had more sex than they might have had if they weren't on the pill. And chlamydia is one of the common STDs that will make you sterile. So, what happens is if you get 3 chlamydia infections, which can be very asymptomatic in women, you're essentially sterile from that. So
Wow.
then you get off the pill, you're not getting pregnant. And so then you end up with IVF. And IVF makes you super ovulate with strong estrogens.
Mm.
So if this is one thing that would really decrease a lot of breast cancer. If you smoke cigarettes after you have a kid, so say you're 18, have a kid, you start smoking cigarettes, your risk goes up about 69%.
Wow.
However, if you start smoking cigarettes before you have a kid and your breast tissue is largely not matured at all or isn't matured at all because you haven't had a kid, your risk goes up 600%.
Wow, we.
So tenfold more. Now, if you smoke cigarettes, uh, your risk for lung cancer goes up 1,500%.
Mm.
But smoking cigarettes and not drinking would really decrease the number of breast cancer cases,
Wow.
especially in young women before they have a child.
And that's not even, I don't even think the tobacco industry even warns, or
No, they
they don't
don't.
even
A lot of
warn,
a lot
you
of
know,
people a lot of people don't know about that.
no, the tobacco or the alcohol
Yeah.
industry.
And
Yeah.
the other thing is vitamin D. A lot of times everybody is has lower vitamin D levels. And because especially, they don't want to damage their skin. You make it when the sun shines on your skin, you make vitamin D. So people should have their levels of vitamin D checked in their blood because an astoundingly high number of women with breast cancer have low vitamin D levels.
Mm, yeah.
But
My doctor's big on vitamin D.
yeah, I have a chapter in our risk and prevention booklet
Mhm.
that talks about a lot of the things you can do too. And that is available free online as well in a PDF file.
Awesome.
So if you go to our website, you can see those things and actually omega-3 fatty acids, like you get in cold water fish, like mackerel and stuff like that. That has people who eat a lot of that have a lower risk.
Wow.
So there are some dietary things you can do.
Well, this has been just so informative, and I hope that all the listeners and the viewers check out your website at it's BCP, Breast Cancer Prevention Institute.org. There's free resources that are so informative, and we want to do whatever it takes for you to stay healthy and not develop breast cancer. And then I'm sure there's lots of research on there about. You know,
There's a publications page. I mean, like under the resource tab, there's a tab for publications.
okay.
And so all the medical stuff that I talked about and that's more detailed, you can download the uh, the um,
The articles.
the article. Now, another one I forgot to tell you about is cannabis.
Cannabis.
Yes, cannabis and all of its metabolites, THC, uh, what? There are two others.
I don't know them.
Oh,
Yeah.
I'm blocking, but anyway, it turns out that cannabis and all of the metabolites of it, including the ones you get in gummies to treat arthritis, are actually genotoxins. Where when your body is replicating the DNA, it takes segments of DNA and puts them in the wrong place. And that's called translocations.
Wow.
So if you look at there's an article, I think it's the first article. It was a paper that was published by two Australian doctors from the Perth area, Western Australia, and it's on our website, downloadable for free. And it's based on CDC data from 2003 to 2017. And it's fascinating. And they also looked at whether it was whether or not abortion was associated with breast cancer. And those doctors found that it was based on CDC data. It's very interesting. It's such a carcinogen that the veterinarians said, don't let anybody put hemp, which has those metabolizers in it, in animal feed. It's bad for the animals,
God.
and it'll get in the food chain.
Wow.
And so Switzerland didn't put it in their animal feed, but France and Germany did. And the rate of congenital defects went up in France and Germany because when you smoke, when you use THC and get all its metabolites, it not only affects your body cells, it affects your gametes. So it affects the ova, the eggs in women, and
Wow.
the sperm in men. So
Wow.
it's sort of like DES. Remember DES that they used to reduce the risk of miscarriage, and then the female children would get these weird cancers like vaginal cancers and things like that. It was because it affected the next generation as well. So
Wow.
you can get that paper on our website as well,
Yes, that's
and
something I hadn't
take
heard
it to your
before.
doctor and
Yeah.
have them look at it. It's
Yeah.
really interesting.
Wow. And I had not heard. So now there's another reason not to support
In
the legalization.
Colorado, in
Yeah.
Colorado and the states where they made it legal, they have the highest rates of congenital abnormalities.
Wow. Wow.
I know.
And would that
It's
also,
really bad.
yeah, we have 4 minutes. Would that also include the increased risk of breast cancer?
Sure.
Yeah, that's what you were saying. Yeah, I just wanted to
Yeah.
make sure.
It's all cancers
Wow. Wow. And we
because
don't want that.
it
You don't want to
no, we
increase
hate
breast
that.
cancer.
We
Yeah.
hate that. And
Yeah.
if you JAMA just published a study saying that younger women and younger people were getting all these colon cancers, breast cancers, and they had no idea why. Well, let's look at lifestyle.
Yeah. Are you smoking pot? You know,
Yeah.
are you taking
Now
the
you can smoke
gummies?
pot and never get it. You can have abortions and never get it, but a certain number of people will.
But do you want to play Russian roulette with your life? That's the whole thing.
Not particularly.
Do you want to play Russian roulette? Well,
Great talk
Dr.
to you.
Lanfranchi, I'm sorry to end this. I'm going to have you back on again because it was so interesting, so informative, and I want to thank you for your time. But we're out of time. And
Yes.
but yes, please visit the Breast Cancer Prevention Institute. The website is right there on the screen. Get informed, get healthy, and we just want to end with this: abortion is not health care. It is absolutely totally opposite of healthcare. It's a health risk. So thank you for listening in to More to the Story with Molly White. I want to thank Dr. Steve Hotze with Hotze Health and Wellness Center for being the sponsor of our show. If you would like to sponsor it as well, you can go to our website, which is along the bottom of the screen, and get information there. Thank you for tuning in, and God bless you. Bye-bye.
Amen.